Good morning. I think we'll start off our webinar.
Good morning, Diana.
Yes. Okay. So, good morning, everyone. I am your host, Dr. Dianna Henry Selvaraj, clinical lead at Securra Health. If you've been a regular at our monthly webinars, I wouldn't be a new face to you anymore. I welcome all of you to the Wellness webinar series brought to you by Star Health Insurance and Securra Health. We're happy to meet you every month and create awareness and insights on various topics to take care of your overall wellness. Let us kickstart this Saturday on a healthy note. Cancer is a topic that touches the lives of millions across the globe, whether through personal experiences, through supporting loved ones, seeking to prevent the occurrence, or so on. This webinar on cancer aims to equip you with all the comprehensive understanding of cancer, covering crucial aspects such as risk factors, detection, and lifestyle modifications. Moving on, this month, the topic of our highly anticipated webinar is Everything You Need to Know About Cancer, and we are collaborating with VS Hospitals Chetpit. We have an exceptional panel of experts. Our first panelist is Dr. Nithya, Senior Consultant Medical Oncologist at VS Hospitals. Dr. Nithya has an extensive understanding and interest in novel therapies such as immunotherapy and molecular targeted therapies. She also has a deep passion towards research and has multiple publications in her name. We also have Dr. Senthil Kumar, who is a consultant surgical oncologist. He is an alumni of two distinguished institutions, the Keelpok Medical College and the Madras Medical College. He is well renowned for advocating and performing fertility preserving gynecological cancer surgeries wherever possible. He also specializes in gastrointestinal and peritoneal cancers. I extend a warm welcome to both Dr. Nithya and Dr. Senthil, and we're looking forward to hearing you both share insights, expertise, and perspectives on various aspects of cancer.
Thank you.
Yes, Dr. Nithya. So, as you see here, there's a lot of statistics on the slide. So, more women die of cervical cancer in India compared to any other country. And cancer causes the second highest death rates in the world after heart disease. These statistics are staggering. Cancer affects individuals at all ages, genders, and backgrounds, and its impact reverberates over communities and societies. However, with knowledge comes power, the power to raise awareness, the power to prevent, the power to support, and the power to inspire change. And as mentioned in here, three-fourths of the cancers that are caused by modifiable risk factors are preventable. This enhances the need for adequate awareness and education on this topic. Before kickstarting our panel discussion, let us have a quick quiz. Audience can type out the answers on our chat box. So here is our first question for the audience. Cancer is the result of uncontrolled growth of abnormal cells anywhere in the body. Is this true or false? So, like I mentioned, audience can answer in the chat box that you have. We've got a couple of answers. We've got a false. Any other answers? Okay. Thank you. Okay. So we've got a couple of people answering. Let's see what the answer is. The answer is true. Thank you for your answers. Okay. Going on to the next question. Which of the following lifestyle modifications can reduce your risk of cancer? Again, all of you can answer in the chat box that you have. We're getting a couple of answers. Answer D, answer all of the above. Great. Okay, so we'll see the answer now. The answer is all of the above. Great answers. I think most of you got this right. Moving on to the next question, which is artificial sweeteners can cause cancer. Is this true or false? If you've been following the current news, I think many of you can answer this. Great. Okay, so we've got a couple of right answers. The answer is yes, true. Aspartame, which is one of the common sweeteners, has been named by the WHO as a possible carcinogen. And Diet Coke and Zero Sugar and so on have been, having campaigns for tackling diabetes, but everyone's forgotten cancer. So moving on. So thank you all for participating. We now will move on to the panel discussion and hear what our doctors have to say. Sure. So this is our first question to both our doctors. To what extent do genetic mutations and family history contribute to the development of cancer? So doctors, you can take this up.
Yeah, I would say like 10% of overall that we have family history as well as genetic reasons attributing to that of cancer. What it essentially means is 90% of the cases it's not always hereditary. So the 10%, yes, we have important genetic mutations which can be passed down the families. Remember, cancer is not passed down the genes, down the family. It is just the genetic modification that can be passed down. So it means that the family member can be more susceptible to cancer, and there are some trigger events which can actually make the cancer manifest in the the person. So 10% is the answer to your question.
Sure, doctor. Dr. Nithya, would you like to add on anything to this?
I think these are two different things. When we talk about familial cancers, that is what the genetic mutation does. So that is around 10%. But there are plenty of people who come now with a history of cancer. So when you ask them about the family history, they do talk about close first degree or second degree relatives having cancers. But it is our duty to actually find out if they are mapped onto the particular gene. So genetic mutations are now, the testing is now available extensively. So I think in the coming years, we will have a significant percentage of mutations being detected. So it's going to be more. Right now, we are not able to do it for everyone. So once we start doing genetic studies for everyone, we will know how to map the cancers. So yes, familial cancers, meaning the same cancer coming in the family members of various generations, yes, around 5 to 10% is what we see.
Thank you for that answer, doctors. So I have a question here. So if I have a blood relative who has cancer, so when should I get screening and when should I be worried?
It depends on what is the type of cancer it is. Okay,
sure,
for example, if you have a blood relative with an oral cancer, for example, for all that you know, that cancer is not a hereditary link cancer. It may be related to the environmental factor, possibly a smoker. He could have got it. So that does not make you more susceptible. But if it is going to be something like a breast cancer or an ovarian cancer, where you know that the strong family history link can be there, it also depends on the what type of cancer it is, at what was the age of diagnosis. A 90-year-old developing an ovarian cancer does not make a relative to be a higher risk for developing an ovarian cancer. However, if the lady who's developed is 40 years, then the risk is a lot more higher. So it depends on what is the type of cancer, what is the age, and what is the site of cancer, and accordingly the risk will be more.
Sure. Thank you for that
answer. It
also
depends upon the type of genetic mutation, because certain mutations have a great penetrance. There are even now we do a lot of mutation testing in cancer, and there are many unrelated mutations which may or may not be significant. So the particular gene should have a strong predisposition to be passed on through generations. So we need to know exactly know whether the person in the family has got a genetically related cancer which has been transmitted. So with that idea, we can actually go for screening. But this doesn't actually exclude anyone from going through the regular screening protocols. So that has to be followed irrespective of whether there is a family history or not. We just have to be more careful if there is a first or a second generation relative, first or a second degree relative with cancer, and that has to be kept in mind.
Great. I think that answers my question. So thank you, Dr. Senthil and Dr. Nithya. I see a few of you have raised your hands. Maybe you've got a few questions to ask. If anyone has any question, please put on your questions in the chat box again or in the question and answer box, and we will take up your questions at the end of this panel discussion. So moving on to the next question. So what are the somatic and acquired mutations that drive cancer, doctor? So we've been talking a lot about mutations. So I think this question itself might need a little bit of explanation for some of our audience. So if you could explain what this question means and what the answer is to this question, so that will be great.
So there are two types of mutations. Basically, one is the the genetically driven, where the person is born with the mutation, and this somatic or acquired mutation is something that the person acquires through life. So what is an acquired mutation is, through the period of life, there are many changes happening. In fact, there are several cancer cells being formed every day in the body because of a mismatched repair. The cell is not able, a damaged cell is not able to repair itself properly. So in the process, there is a mismatch in the number of DNA base pairs or something like that at the genetic level. So the cell becomes abnormal, but the body has a capacity to identify such cells and destroy them immediately. There is a big surveillance,
Okay.
immune surveillance mechanism happening. So as long as the immune system is intact, it will identify all these abnormally repaired cells, or any abnormal cell for that matter, and destroy the cell immediately, because they are not supposed to go through the regeneration process or the multiplication process. In case there is an immunodeficiency, or the immune surveillance is not intact, or the number of cells which have these abnormal genetic components start increasing in a very big volume, as in aging. As the person ages, the capacity to repair the particular cell comes down. So there is an accumulation of all these genetic changes, which in turn become mutations. So as the person ages, the number of mutations will keep increasing. So we normally, now we do a big panel of testing to find out what mutations are there in the cell. So we notice that there are frequent unrelated mutations which we don't know whether they are of any significance at all. So, but there are some mutations which can be acquired and in turn cause cancer. So once you take someone like someone who smokes, so the whatever the coal tar or whatever the carcinogenic component of smoke is there, it's going to cause a cell damage and constantly cause genetic mutations in that, and that is the reason for the cancer. That doesn't mean that this particular mutation needs to be transmitted through generations. So for that person, that particular mutation is the cause of the cancer. So that is what we call as the somatic and acquired mutation. So this is not, they're not born with the mutation, it's not familial or genetic, but they have the mutation over a period of time during their life.
Yeah, these, as
Yes.
Nithya rightly put it, acquired
Yes, Dr.
mutations
Sandra.
are
Yes.
happening every day and day out. Every day we get exposed to some agent which produces damage in the DNA. Most of them are not lethal. So if they are lethal, the cell dies. If they are non-lethal, we have changes that happen in the DNA, and we have a molecular policeman called as, a lot of molecular markers are there, genomes are there, which can correct these genomic changes. When these are not corrected, that is when we end up having a lot of cancerous changes. Remember that the cells will normally undergo apoptosis. Apoptosis is normal natural death of these cells. Okay. So when this does not happen, again they can go into develop a cancer. All this is controlled by our own genomic mechanisms. When they are not able to control this, that is when we end up with a cancer.
Great. I think we've got a lot of clarity with both those answers. Thank you so much, doctors. So we will move on to the next question. I still see a few of the audience raising your hands. Please, if you have any questions, uh, just type out your questions in the chat box and we will take them after the panel discussion. Thank you. So moving on to the next question. What is the impact of smoking, obesity, and alcohol in cancer development, doctors? So we've been hearing a lot about how smoking is impacting diseases, how obesity and alcohol play a role, but what exactly is the impact for cancer?
Smoking is one agent where you link any cancer to it, chances are you will be right, because it is going to affect every cell from the foot, head to foot. So it does affect most of the organs, and it is a carcinogenic, contains a hell of a lot of number of carcinogens. Okay, so it can produce cancer starting from the oral cavity, the lungs, the GI tract, including the stomach, the colon. Okay, lungs. These are all areas where you can have cancers related to smoking. It is to be kept in mind that smoking does not mean only the smoked tobacco. Okay, the non-smoked tobacco which people consume in various forms, as kini, the quids that they keep in their oral cavity, the snuff that they use, all these also produce a lot of cancerous changes in the body. It is not only the place where it is kept, there is a general belief that if they keep a quid in the oral cavity, only there they will develop a cancer. No, it is not the case, because these carcinogens are going to be released into the system. They get absorbed. It can produce changes in multiple areas. They can develop a cancer in the larynx, the vocal cords. They can develop a cancer in the upper gastrointestinal tract or the lungs. So cancer is, a lot of changes can happen because of smoking in various organs. So is the case with obesity and alcohol. In fact, obesity, we have what is called as a commonly called as a syndrome we have called as corpus cancer syndrome. This is very common in women, where they are, most of them will be diabetic, they'll be obese, they'll develop breast and uterine cancers. So these are all situations where obesity itself is a predisposing factors. You have to keep in mind that those people who are obese tend to have a higher BMI. They are also important predisposing factors for your upper GI cancers, like the proximal stomach cancers. Alcohol again is an important potentiator, more so when it is combined with the presence of smoking as well as alcohol. It's an additive synergistic addition. That is, the combination is worse than each of them together or separately. So all these have different effects on different cells, and they are all carcinogenic agents.
Thank you, Doctor. I have two leading questions to this. So one, as you mentioned, there are other forms of tobacco or other forms of smoke as well. So right now, in this day and age, vaping and e-smoke has become quite common. So is there any research or is there any, publication or anything that tells us of what probably is the effect of e-smoke or vaping? Or is there any proven effects for cancer?
E-smoking and vapors are equally bad. Just that the concept of the damage in the oral cavity may be less, but the damage to the lung alveoli is equally bad, if not worse, compared to the conventional smoking. Definitely, e-smoking is equally bad and equally carcinogenic.
Sure, Doctor. And also, the second leading question that I had was quantity versus incidence. So some people would say, oh, I only smoke just one cigarette a day, or I just have one drink a week. So does the quantity of consumption affect the incidence rates?
It definitely affects some. We have something called a pack here. So the number of packs smoked, packs of cigarettes smoked per day, per year. So a particular number, each cancer has a particular risk factor, the number of pack years. Mm-hmm. So that is how we relate the cancer to the smoking. So any smoking, it's not going to be, of course, smoking has other potential comorbid illnesses. It causes other potential illnesses rather than cancer. More than cancer, it's going to cause a cardiac disease immediately with a much lesser number. So we don't look at cancer alone as a cause of, as a consequence of smoking. So most of our patients who develop cancer are long-term smokers, and it takes at least about 20 to 25 years for the risk to come down after the person stops smoking. Till then, the risk is definitely going to be there, but it's always worth stopping smoking at any point in time, because the risk is definitely going to come down after that. The same thing goes with alcohol. Alcohol, over a period of time, it's going to cause damage to the liver. So that is one, even in low doses of regular alcohol intake, is going to cause something called a chronic liver disease and cirrhosis, which eventually predisposes to liver cancer. So that is one of the prime organs affected by alcohol. Even otherwise, regular alcohol intake over a period of time, as Dr. Senthil has said, along with smoking, most of our people have that combined habit. So that is going to potentiate cancers of the gastrointestinal tract, like the esophagus, stomach, colon, and even the urinary bladder. So that is also an important factor. So when smoking, alcohol are together, the pack years really doesn't matter for certain cancers. It's going to be really bad. It's going to come earlier.
Yeah, Doctor. And I think it's a very common occurrence in clinical practice, where you have patients who say, I've quit smoking or drinking. And then when you ask them when, they say, 1 day back or 2 days back. So I think what kind of advice would you give current smokers and current alcohol people who currently consume alcohol?
Even if you stop today, it is fine. The protection lasts for years together after they stop. So, the risk of cancer starts coming down the day you start the day they stop smoking, of course, going to be there for about 15, 20 years, depending upon the number of years and number of cigarettes that they have smoked over a period of time. But the risk will definitely reduce. And maybe after 20 or 25 years, we can say that they would not get cancer because of smoking. So they need to be very careful about, developing this habit. Basically, people know it's bad, and then it causes cancer and heart disease, and still take up smoking. I think it is important to quit today. That's what it's going to help. In fact, when we used to study, our professors used to say, 50%, at least 50% of cancers can come down if tobacco is stopped. So that is the impact of tobacco on the society and the overall incidence of cancer per se. So that is going to be a huge health impact.
Great. Thank you for those answers, Dr. Senthil and Dr. Nithya. I think the takeaway from this is stopping of smoking and alcohol consumption today also is helpful. So yes, we'll move on to the next question. Okay, so getting X-rays and CT scans, doctors, how safe is this? We have a lot of people who would probably come to a clinic and say, I don't want to take this X-ray, I don't want to take this CT because it's not good for me. So how safe is it, doctor, and when should we avoid it?
See, it is important to keep in mind that X-rays and CTs, the worry is because of the radiation exposure. Okay, and this is exactly the reason why people are worried. And always keep in mind that our environment is not having a background radiation. Every environment, the room you are sitting, always has a background irradiation. This is because some innate gases like radon are there. We are exposed to a lot of fossil materials. All these do eliminate some amount of background radiation. So compared to that, say the exposure to a radiation in an average Indian room is approximately about 10 days, over a period of 10 days is about 1 millisieverts. Okay, that is the radiation exposure we talk about. Whereas when we do take a chest X-ray, it is about 0.1 millisieverts. So what happens over 10 days? The 0.1 millisieverts exposure in a background radiation, you're getting the same exposure in a single X-ray. That is the amount of radiation that you get exposed in a X-ray. Suppose you do take a CT scan, CT chest, okay, the exposure is about 7 to 10 millisieverts. So definitely there is some amount of radiation exposure that is there. And that is the reason why doctors advise that we should not undergo unnecessary X-rays or CT scans, because cumulative amount of radiation exposure is not going to be good. In fact, if you look at the common tendencies now is to ask for a PET CT scan. A single whole body PET CT scan is approximately equal to exposure of about 100 millisieverts. Okay, so that is the amount of exposure that we are talking about. So we have to limit our radiation exposure. Yes, the single exposure is not going to be a big problem. Taking a mammogram once in a year or once every 2 years, the amount of radiation exposure is going to be very, very low. However, doing it repeatedly is definitely fraught with problems. And this is the reason why we do recommend ultrasounds and MRIs more as a follow-up, even for cancer patients, because we don't want to expose them to a lot of radiation. Yes, it is a necessary tool, but use it with caution.
Yeah, I think that was really nicely said. Necessary tool, but use it with caution. I think that was great. So, Dr. Nithya, anything to add on to this?
I think there are certain cancers where we need a PET CT. So this question commonly comes with when patients are getting treated with cancer. So we need to do imaging frequently to find out how their cancer is, at least for the first 5 years of treatment, to find out if their cancers are, okay. So I think MRI is coming in a big way. We had PET CT, of course, certain cancers we do have to use PET CT only, but MRI is coming in a big way. So wherever, even for breast, now the recommendation is to undergo an X-ray mammogram every 1 or 2 years to find out if there is any risk of or any evidence of malignancy there. But breast MRI is again becoming more and more available. Of course, it is more expensive, I agree, but there is absolutely no radiation exposure with breast MRI. So in case the person is so concerned about getting exposure through a mammogram, I think they can go for an MR mammogram instead of a regular X-ray mammogram to reduce the exposure. As Dr. Senthil said, we have been getting a lot of patients who come and ask, there are a lot of cancers in the family, can I do a PET scan and find out if they have cancer? At that moment, yes, but What about the next day? If they're going to develop cancer in the next 2 months, are they going to do the PET CT again and again? It really doesn't have any kind of screening benefit. So I would really ask everyone to avoid asking for ionizing radiation like X-rays or CT scans unnecessarily. Even for an X-ray, you go with a cough and a cold for 5-6 days, nobody's going to ask you for an X-ray. Only when it doesn't get all right for the next 10 days, they're going to ask for an X-ray. So don't go for an X-ray straight away. Just manage with symptomatic treatment. Get the X-ray done only when the doctor asks you to do it. There is absolutely no need to go and do all these kind of imaging unnecessarily. So I would go with that. I would definitely advise people to go with that, because PET CTs are now so accessible. People just want a prescription for a PET CT and find out if they have a risk of cancer or if they have any cancer at all. So I think it should be avoided.
Sure, doctor. And what would be the advice for babies and pregnant women who need any outside, any kind of imaging?
MR is the best imaging for pregnancy, because, of course, that also unnecessarily we shouldn't be doing. But in case there is an absolute need for imaging during pregnancy, it is an MRI, not an X-ray. X-rays and CT scans and PET CTs are absolutely contraindicated. They cannot undergo it at any cost. MRI is a better tool. For babies, yes, if there is a need, they will sedate the baby and do an MRI. So that is a better option for the smaller children. Now, diffusion weighted MRI is now coming up in a big way. So I think that would be safer than a PET CT or a CT scan in pregnant women and younger children.
Sure. Thank you for that detailed answers. So we'll move on to the next question, which is screening for cancer. So what are the options available? I know we have spoken a little bit about not asking for PET scans and so on. So what are the other options in addition to the MR mammogram, like you mentioned? So what are the other options do we have?
So basically, screening, the word screening itself means trying to diagnose the cancer before the person develops any symptoms because of it. So we have to go for something that is very economical, which is easily doable, which doesn't have long-term adverse reactions. For a mammogram to be recommended as a screening tool for breast cancer, it took them almost 40 to 50 years to make sure that a yearly mammogram does not increase the risk of breast cancer because of the radiation. Now we know it doesn't increase. So basically, for women, there are 2 cancers for which screening is available, meaning it can be diagnosed in the pre-malignant state or in a very early state, as in breast and cervical cancer. Uterine cervix is the common malignancy amongst women. Till a few months or years ago, it was the commonest cancer, which is now overtaken by breast cancer. So cervical cancer, the screening option will be a good quality pap smear or a liquid-based cytology. So that has to be done as soon as the a woman becomes fertile or gets exposed to a sexual activity. So that is one of the screening methods, and it is so effective that it can diagnose the cervical cancer in a pre-malignant state, even before the cancer develops, so that preventive measures can be taken, or even the minimal treatment can be taken, and the cancer can be avoided. As in case of breast cancer, it is a mammogram done after the age of 40 or maybe about 5 years earlier if there is a strong family history of breast cancer. It is done either yearly or once in 2 years. So with that, they are able to detect very early findings like microcalcifications or a small abnormality which might indicate that there would be a malignant change there. So this condition called ductal carcinoma in situ, which is called an in situ cancer, which has just developed in the ducts, that can be very easily picked up on a screening mammogram and even an MRI mammogram. So until MRI becomes very widely accessible and less expensive, it cannot be recommended for a screening for everyone except in high risk cases. But a regular mammogram is generally recommended for women above the age of 40, either once in a year or once in 2 years, depending upon the availability. And it is to be done at least till the age of 70 to 75, following which we don't have a big survival benefit, so we don't recommend screening beyond that. For men, there is no actual recommendation for screening, but there are some high risk screening features. Like if there is a strong, this applies to women as well, if there is a strong family history of colon cancer, especially the one associated with a genetic change. So these people have a screening recommendation for a colonoscopy once in 5 years. They can get a stool occult blood. to see if there is any bleeding in the stool. That can be done every year. It's a non-invasive testing, so that can be done every year. And they can also have a colonoscopy or a sigmoidoscopy depending upon the kind of cancer that the family member has had. Of late, there has been a huge increase in prostatic malignancy, prostate cancers in men. So we recommend, it is, although it is not widely recommended as a screening tool, but we would generally recommend people to undergo a PSA blood testing after the age of 45 once in a year, along with their regular health check. We will be able to detect very early stages of prostate cancer, because the symptoms of prostate cancer are very similar to that of a urinary infection. So it is very difficult for the person to identify it. So we would recommend. So this is what we recommend as a tool. There are several other modalities which are available, but they are not standard recommendations for screening in most of these people, especially the low dose CT scan for smokers to detect lung cancer. So these are not recommended, but only these three or four recommendations are presently there.
Okay, doctor, thank you. That was so detailed. Thank you. Dr. Senthil, anything to add on?
Yeah, Nithya has already summarized the most important indications we have available for screening. But what is to be kept in mind that not all cancers do we screen. The reason is screening should be used where you can detect a tumor in a very early stage. That is, before it becomes manifest as with symptoms, where we have a lead time bias. That is, by diagnosing that, we have treatment options wherein we can either pick it up in an early stage or avoid the development of the cancer in totality, or the most important thing, we reduce the mortality. That is, the death due to the cancer can be reduced. So this is possible only in few cancers, and few cancers there is not a possibility at all. So we select these screening for these sort of cancers. And add to it the other important small changes that happen in skin. For example, skin cancers may not be so very relevant in our population, but if you take up the Australians, for example, they have a very important screening for the melanoma, because their skin is very prone for developing melanomas. They have these screening programs. Any skin change they immediately go under a program of melanoma screening. That part of the arm or chest or face, they have repeated photographs done. They have biopsies done if necessary to look for small change that happens in these moles also. So depending on the situation where you live, which cancer is prevalent there, where you have a tool to decrease the cancer deaths, their screening is available and you should be used.
Sure, doctor. And for a common man, who would be the best doctor to visit in case they have a doubt? So is it a general physician? Is it an oncologist? Who would be the best specialist, or who would be the best doctor?
You don't require an oncologist for a screening for cancer. His general physician whose family physician who's been managing him, will be able to do all that is required for a screening for a cancer. The oncologist is required only for treatment of specific cancers, where they will have the latest protocols and treatment guidelines. For screening for cancer, any person who is a family physician whom he's been treating that family should be able to screen for cancers.
Great. Thank you for those answers, doctors. So we'll move on to the next question. What are the most common types of cancer in men and women? I think we've touched on this already, but if you can just list it out.
In women, yes, the breast cancer is the commonest. It was the cancer of the uterine cervix, which was most common in women till a few years ago, but it is now coming down in incidence because of various reasons. And breast cancer is now the commonest cancer. In fact, there's even a common joke that says that there'll be only two types of clinics. One will be the breast clinic and one will be the other cancers clinic. So that's going to be the impact of breast cancer in the coming years. The other types of cancers which have been increasing, there has been a great change in the trend of cancers in both men and women over the last 10 years. And we have seen cancers like colorectal cancers, the cancer of the large intestine, and cancers of the lymphomas, the liver cancers, oral cavity, because of the indigenous habit of chewing tobacco. It's very exclusive, almost very exclusive in India, because they don't see this kind of cancers too much in the Western world. It is because of the habit of chewing and retaining tobacco inside their oral cavity. So that is one common cancer. And we have a lot of lifestyle related cancers coming in, like lymphomas, the pancreatic cancers, liver cancers, the endometrial cancers, which is the uterine body cancers. So all that has been increasing. They occupy a close third, fourth, and fifth. So the commonest type of cancers, the commonest cancer is breast cancer, and the other cancers are way behind. So that's what I would say in women. In men, it is still lung and stomach. They fight for the first place on and off. So that's been there. And mostly we see only these two cancers commonly. Again, the head and neck cancers because of the tobacco chewing habit and the usage of snuff. The other type is the GIT. Again, the colorectal and the liver cancers are also common amongst men. Prostate cancer, yes, it is slowly creeping up into the top 10, and it will probably come back into the top. That is again a lifestyle related cancer. Just like how women get breast cancer, the male equivalent is the prostate cancer.
Sure, doctor. And I think these days, the importance of human papillomavirus has become quite profound. So what are the cancers that they cause, doctor?
Human papillomavirus is one of the most important agents listed for cancer cervix, cancer of the vagina, similarly for the anal canal cancers, and also on the oral and oropharyngeal cancers. So all these areas, the human papillomavirus is implicated. Now, you should keep in mind that this is one cancer where we have a vaccine that can prevent development of cancer. We have a vaccine for the human papillomavirus, which is usually given to the girl children around 9 to 15 years of age. That is when it's the best given. But up to any time before the first exposure happens, if you give these human papillomavirus, the most important key carcinogenic viruses are covered. It means that they will be protected against the in situ as well as the invasive cancers recurring from that. Yeah. But it does not eliminate the need for screening for these women for cancer cervix. The reason is not all the viruses under HPV are covered. The most important viruses can be covered. So yes, we have a vaccine for HPV that will help in prevention of cancer cervix, and also for the men folk also. But the protection that we get in men folk against penile cancers and anal cancers is very less compared to that of a cancer cervix.
Sure, doctor. And as you mentioned, you said the vaccine for HPV should be ideally taken before the first exposure. So what happens when there's a middle-aged woman who wants to take this vaccine? Does it work or does it not work?
It does work, but the efficiency drops. The protection from what is 95 to 99% when it happens before the exposure drops down to 60 to 50%. So the efficacy drops, and already the patient has a HPV infection in place or an exposure where it has happened, then it may not have the same amount of protection.
Sure, doctor. Okay. Thank you for answering these questions. So we'll move on to the next question. So what are the common myths and misconceptions of cancer, doctors? So anything that you've heard of, anything that you want to address here?
Cancer is a death sentence. Now, this is a common misconception that people have. No, it is not. Most cancers, especially when diagnosed early, are curable. Especially pediatric cancers, the cure rate is very, very high. Even in advanced cancers, we have now technologies, we have now a lot of treatment options. We are trying to push the borders towards the cure rate is higher and higher every passing year. Mm-hmm. Yes, we do find difficulties when you have an advanced stage, a very recurrence or a metastatic disease where the cure rate is not for really that high. Your cure rate drops. But you should keep in mind that cancer is not a death sentence. Cancer is not contagious. This is something that very, very often even educated people ask these doubts. My father is having a throat cancer. He is getting treatment. Now I have small children at my home. Can they be together with him? Can they? What happens if they drink water from the same glass? No, it is not contagious. It is not an infection. It will not spread from somebody like that. Okay. So somebody eats in the same plate. It does not mean that cancer will spread to them. The most common myths and misconceptions are there in cancer. And this is something that we need to get rid of.
Great, doctor. So, Dr. Senthil, thank you.
There is something else with
yes, Dr. Nithya. I was going to ask you.
Patients who have a diagnosis of some swelling or some kind of a symptom is having a biopsy makes the cancer spread to the other parts of the body. So we have seen patients who refuse a biopsy, come back a year later with a lot of advanced disease. One common misconception is the cancer spreads after a biopsy. There are some cancers where biopsy should not be done, and we would never recommend. So only if we do a biopsy or some testing, we would be able to diagnose cancer. So avoiding a biopsy actually makes it worse for the patient. So that is one misconception that patients usually have. I do have patients walking in every day to my clinic refusing a biopsy because it will make the cancer go spread elsewhere. My basic explanation is we are going to treat the cancer even after diagnosis. So it doesn't matter if a few cells come out. It doesn't happen that way. So we have to take the cells, find out what kind of a tumor it is, and we'll definitely have to treat it accordingly. So unless they do a biopsy, they will not have a diagnosis. And unless you have a diagnosis, there will be no treatment. So that is one common misconception that people have, and that is the reason they refuse the biopsy. So I think we should be avoiding that.
Sure, doctor. And couple of myths from my side that I've heard. So it's very common understanding that breast cancer is a cancer of women, which is not true. So do you want to explain that, doctor? And can you tell us if and what are the incidence rates in men?
See, breast cancer is much more common in women. There is no denying the fact. But keep in mind that men can also develop breast cancer. We are talking about 1% of overall breast cancers. 1 to 2% is the overall incidence of breast cancers in men. Okay, so the problem is the men do not know that breast cancer can happen in men at all. So the reason being that they don't perceive that as an abnormality. So the difference is stage-wise, the breast cancer in men or women, the treatment prognosis, everything is almost similar. There is no difference. The problem is the men detected quite late. By the time they come to the hospital for presentation, it's quite advanced. So that is a problem. Breast cancer can occur in men too. Yes, you need to be aware of it.
And are the signs and symptoms the same as what happens in women, doctor?
Usually it is the similar. The lumps that are palpable, the skin changes, occasional bleeding from the ulcer, nipple discharge, presentation with the armpit swelling. This is the common symptoms. It is similar for men as well.
Sure. Sure. And the other usual myth that we hear is that it's a misconception that cell phones can cause cancer. So how true is this? Is it a myth or is this reality?
We definitely don't have a lot of evidence to say that common usage of cell phones causes cancer, although they have noticed an increased incidence of the acoustic neuromas when they keep using the cell phones. Acoustic neuroma is a tumor of the auditory nerve. So whether it is factually related or spatially related, we really don't know. But till now, I think there is not much evidence to say. There is no concrete evidence to say that yes, cell phone usage causes cancer. So it is definitely a controversial topic. Even if it doesn't cause cancer, I think shouldn't be using it too much. It has other effects as well. So
sure, doctor. And the last myth is that alternative medicines or medications work for cancer. How true is this or how false is this?
it might work. See, we are allopathic physicians, so we have no experience using alternative medicine or the Indian system of medicine. It is likely to work. It may work, but the problem is we are not able to give them enough evidence to say that it has worked in a significant number of patients. So all that we can say is yes, I can tell you how much of a response my prescription or my treatment is going to give, but I wouldn't be able to commit about alternative medicine as such. We need more studies and more trials in alternative medicine. Only then people will be convinced. So that is one thing we really need. There are a lot of patients who go for alternative medicine along with the allopathic prescription, and they say that they feel much better after taking there are so many concoctions and many medications for general health. So that is what they report to me. But we don't have experience because we don't prescribe, so we are not able to actually tell.
Okay, doctor, thank you for those answers. I think we've had a lot of myths busted and misconceptions cleared off. So we will move on to the next question, which is this is the last question for the day in the panel discussion, and then we'll move on to the audience questions. I think the audience have asked a lot of questions today, so we will take that up one by one. Before that, this is the last question for today. What are the preventive measures that we can adopt to prevent cancer?
Preventive measures start from childhood. Okay, a healthy way of living has to be the way forward. We know that whatever we eat, whatever we inhale, everything contains a lot of potential toxins, right? Ideally, we should change the environment which we are not able to change. But yes, we should try to eat healthy food, maintain a balanced diet, have enough amount of physical activity to make sure that our BMI is the healthy range. Okay, that should be a great start. Avoid all the unnecessary habits, including alcohol, smoking, and drugs. All these are long term going to give problems for us. Next thing is the type of food that you eat. Has to be a balanced food, rich in proteins and fat. It should avoid all the a lot of commercial agents that we have in fast foods, coloring agents, all these very high rich smoked foods, tandoori items. Once in a while you take it, it doesn't really harm you. But if it's going to be a routine affair, definitely it is going to harm your cells. Your potential of developing gastric cancers and colon cancers are very high. Next thing is about the vaccines that we already discussed. Human papillomavirus, yes, vaccine that can be given in childhood. It is a protective agent. You should also remember that we give your hepatitis B antigen vaccine. Okay, hepatitis B vaccine over a long-term period. From it, it develops prevention of the hepatitis B. It is going to help in some way preventing a liver cancer. It does not prevent liver cancers due to other causes, say an alcohol or other hepatitis virus. So this also will help us. So it has to be a balanced physical activity, keeping your diet in place, good workout, avoiding the bad habits, and try to improve the environment in such a way that we live healthier, we live longer, and without cancer.
Great. Thank you for that concise answer, Dr. Senthil. Dr. Nithya, anything from your side?
I think it's just a few mantras. Stop smoking, stop alcohol, live a healthy diet, watch what you eat. Watch what you eat is what I tell all my patients. Just see the nutritional content of anything rather than looking at how tasty it is or how it looks like and all that. So watch for the nutritional content, and something that does not have any nutritional content, please avoid taking it over a long period of time. Once in a while, eating fast food is fine. Eating fast food every day is definitely not healthy because there is no nutritional content. More than the damage it does, we are missing out on the nutritional part of it. We need enough proteins and vitamins to protect us from all these kind of diseases. So if that is completely, the food is devoid of all this, there is no point in taking it every day. And watch the weight. Yes, stay within BMI. It is important, and the focus now is not on general weight loss but a focused weight loss. Avoid developing fat content anywhere in the body. Focus on building your muscles. The more protein you take, the more immunity you have, and the stronger your stamina will be. So I think that you should be very careful. So instead of watching the number of calories that you take, I think it should be the amount of protein and the other micronutrients that you should actually watch for. Reduce fat intake in the body, yes, it is important because there is a rise of non-alcoholic fatty liver disease in the last few years. There's a huge rise. You just go look at any scan, it shows fatty liver. So fatty liver over a period of time, 20-30 years, it's definitely going to lead to a liver cancer. It may lead to a great incidence of liver cancer in the coming years. So cut down on the fat. Generally, you do need fat for maintaining the cholesterol-based hormones in the body. So just keep it to a minimum. We should remember that even our rice and wheat contains a minimal amount of fat. So that is what I would say. But the topmost important thing for people who are really wanting to reduce their incidence of cancer and are smokers, please avoid tobacco in any form. As I always keep saying, the incidence of cancer, the absolute incidence of cancer can come down by more than 50% if tobacco is stopped. So most of the cancers in men are tobacco related. So all of them can be actually brought down by a great number. So that is the most important advice I would definitely give. Of course, this is a question on prevention. So I would definitely advise women to go for their screening process whenever and in whichever age they are eligible. So please don't forget your screening.
Sure. And Dr. Senthil interestingly said avoid tandoor foods. So would you want to elaborate on that, Doctor?
See, any smoked food or salty food, okay, is going to be an increased risk of developing your upper GI cancers. Okay, so if you're going to have that as a routine, 4 days a week, 5 days a week, you're going to have these sort of foods every week. Definitely, you're going to have yourself at higher risk of developing an upper GI cancers. Eating it once in a month for a party, yes, that is okay. That is part of life. But if you want to have it as a routine, definitely it is not healthy.
Thank you, Doctor, for elaborating that. I think that's a wake-up call for a lot of us as well. Thank you. And we will move on now to the audience question. So I would like to open the floor for for questions from our dear audience. I think already a lot of you have asked questions, but if, in case you've still got any questions, do not hesitate to post your questions in the chat box or in the question and answer box. This is a great opportunity to get specialists to answer your doubts and queries. And also, we will be launching a poll. So if you see there's a polling option in Zoom, and if you haven't answered the questions, you can answer it right now. So we will take up the audience questions one by one. So Doctor, I'm going to start with the first question from the audience. Okay. So what are the early signs of cancer, Doctor? So that's from Mr. Bal.
Cancer sign depends on which is the organ that we are talking about. For example, general symptoms will be significant weight loss. Losing about 10% of body weight over a period of 3 months is definitely one of the warning signs. Non-healing ulcer, unnecessary, continuous cough, not responding to your usual treatment with antibiotics or cough suppressants for a period of more than 6 weeks. Significant weight loss, bleeding per rectum, okay, passing blood in the stools, excessive blood loss during the for a lady, okay, and change in moles suddenly become larger, suddenly become ulcerated, start bleeding. All these would be warning signs of developing a cancer. So whenever you have any of these warning signs, it is best that you report to a doctor, get yourself investigated and not self-medicate.
Thank you for answering that question, Doctor. We will move on to the next question from Mr. Kaushik. Will passive smoking cause cancer?
There is an increased risk of cancer with passive smoking over a period of time. Yes, definitely yes. So we also inquire for passive smoking for patients who come without a history of smoking. So your answer is yes. The risk is definitely not as much of that of smokers, but yes, we'll have to get them screened as well. So we will have to look at the option of smoking as a cause of cancer in such patients as well.
Sure, Doctor. And we've got our next question from Mr. Nageshwaran. So he's saying there's a swelling of tonsils due to lymphoma. Tonsils were operated, 6 chemo and radiation therapies have been given. It's been 2 years after treatment, and 2 PET scans after treatment shows nil. But what is the probability that lymphoma would resurface?
There is always a chance of recurrence, and we follow actively, and it depends upon the risk as such. When we say a high risk or a low risk lymphoma, it actually basically tells us the risk of recurrence after treatment. So we actively follow up patients for about 5 years for any patient with lymphoma, and after that we put them on a passive follow-up, meaning they have to come to the hospital whenever they have symptoms. So for 5 years you will have to go to the doctor and get examined through your ENT to find out if there is any history of any risk of recurrence.
Sure, Doctor. And then there is another question. We don't have a name here, but there's a question that says, how about inhaling smokes like sambrani and mosquito coils? Does this cause cancer?
We don't have evidence to say that it is carcinogenic, but too much of any of these not physiological ones can produce respiratory ailments. It may not straight away link this to cancer.
Okay, Doctor. So now we move on to the question from Mr. Abhijit. Deos, air fresheners, mosquito repellents, do they have any effect cancer causing? So I think it's on the same lines. So I think the answer still is there's not enough research to prove it, but anything that is not physiologic is not good. Anything to add on to that, or shall we move on to the next question, Doctor? Shall we move on to the next question? Okay, yeah. So Mr. Praveen asks, okay, what causes an increased breast cancer prevalence? Dr. Senthil, do you want to take that up?
Yeah, breast cancer incidence is related to the amount of the exposure to the patients that they have to a lot of potential carcinogenic agents. Increased BMI, the weight itself is a risk factor for breast cancer. We already discussed about the familial and hereditary risk factors. So there are some genes which are transmitted from the parents or grandparents to the offspring. offsprings, that also increases the risk of breast cancer. So all these are potential agents. Then the increasing urbanization, the trend of women to get married late, have a childbirth late, so early menarche, late menopause, all these are contributory factors in increasing the risk of breast cancer.
Sure. And then the next question is from Mr. Jitendra. I read it somewhere that cancer cells die in presence of oxygen and alkaline body. Please throw some light on it to make some lifestyle changes.
See, alkaline bodies and oxygen is not going to be a treatment strategy for any of these cancers. For example, poorly oxidized tissue, we say that will not respond well to radiation. And that is the reason why we usually keep the hemoglobin levels to a certain level, at least over 9 or 10. That is when the radiation kill of these cancers will help. So using it as a strategy for all cancers is not appropriate. I think we have discussed the second part of the question on prevention strategies for cancer in general. We have discussed it already. Keep a healthy, balanced diet, have a physical workout, keep yourself physically active, and avoid all these bad habits, including smoking. That will go a long way.
Sure, doctor. So, Mr. Pradeep is asking, what are the ways to detect cancer early? I think we've answered this question, so we'll move on to the next question. The next one is, how harmful is PET scan? I think that was answered as well. We will move on to the next question. So this is from Mr. Mukund. He says 67-year-old male with carcinoma of stomach and 2-centimeter lesion in the liver, and underwent chemotherapy, 6 chemotherapy cycles, showing significantly reduced thickening in stomach and sub-center liver lesion. Is surgery of stomach and liver recommended?
I think the person should meet the oncologist and do it. With just few lines of history, we wouldn't be able to comment on that.
Yes. So I think, Mr. Mukund, the best thing would be to meet an oncologist. And then we have another question from Mr. Manoj. He says, I heard there are certain vaccines for girls, and my daughter is 23 years old. Which one would you recommend?
Yeah, we discussed this. Human papillomavirus, you can suggest for your daughter when she becomes 9 years of age. That will go a good way in protecting her against cancer cervix.
Great. Okay, so there's another question from Mr. Abe. What are the main causative factors of cancer other than tobacco, alcohol, obesity, etc.?
Causative agent, one is the genetics. I think we discussed that in the beginning itself.
Yes.
10% of cancers are familial. And of course, your lifestyle, the harmful diets and, the additives in the diet, the carcinogens in the diet are very important. So apart from the smoking and alcohol, I think this is what is most important. We have to remember that most cancers, we don't have a cause. They're cryptogenic. We don't know why the person gets cancer. Although the patient keeps asking us, we are not able to tell them why they had the cancer. But eventually, when we explore, we have other metabolomics or some advanced tests to find out if it was through the diet or a particular agent. I think we wouldn't be able to tell the reason for cancer for most people.
Sure. I think we're running short of time, but we have a couple of more questions to answer, so we'll do this quickly. There's one question from Mr. Amitabha. Is stress a cause of cancer?
It is not directly a cause of cancer, but eventually stress induces a lot of lifestyle changes which may lead to cancer. So a persistent physiological stress, of course, we are not talking about psychological stress here. A persistent physiological stress, as in working late hours, not getting enough sleep, not eating on time, not eating the right kind of food, that also is a very stressful condition. So all that can indirectly lead to predisposed to cancer. I'm not going to say it is going to lead to cancer, but they are definitely going to increase the risk of cancer over a period of several years. It's not going to happen like in 2 or 3 years, as in the case of smoking or tobacco, or any tobacco usage or something like that. But I think that is something that we have to avoid. Live a healthy lifestyle also includes eating on time and, getting adequate number of sleep hours.
Sure. So we'll quickly move on to the rest of the questions. Mr. Manoj says, my wife has BRCA1 positive. What care should I take for my daughter and son?
The BRCA testing positive for daughter is there. We need to check whether the same mutation is present in her also. And age-appropriate strategies are there available for treatment. Okay, I don't think this is the right forum for discussing the treatment options for a BRCA positive lady. Yes, you have to approach your oncologist. This is certain situations where there are treatment options available to decrease the risk or cancer in that patient.
Sure. Thank you, doctor. So there's one question from Mrs. Manjula. She says, I have a daughter who has a pea-sized mole on the breast. Is this common or should I check with a specialist?
Yeah,
So I think you just...
sorry, please go ahead, Nithya. Sorry.
No, sir, please go ahead. Get started.
See, a mole on the breast or in the chest is quite normal. It is physiological. It can happen in any of the sites, and so is the case of the skin over the breast. Okay, it is important that she gets seen by her pediatrician to know it's only a simple mole or something different. Most often they're not. A 9-year-old or an 8-year-old having a mole of this size is going to be physiological, and I would think it is nothing to worry about. But please do consult your pediatrician. They will be able to guide you better.
Sure, doctor. So there's another question from Mrs. Madhumati. She says, I'm a breast cancer survivor. Should I take any measures?
Be watchful, be on follow-up, because if you have had breast cancer in a single breast, I think you should be be very watchful for development of cancer in the other breast as well. So continue doing your mammograms or MRIs as and when indicated, and be watchful. I think that's one thing we missed out. Self-breast examination is very important to diagnose cancer. Most of our lumps in the breast are picked up by women by self-examination themselves. So around 80% of tumors can be detected with a self-breast examination. Please do it monthly once. I think that's a part of you. Take it as a part of your life, like how you go to meet your relatives, or go to school, pick up your children, something like that. It should become a part of your life as a routine. So keep doing your breast self-examination, consult your oncologist or your doctor or your family physician whenever needed, and keep doing mammograms or MRIs. That would be my advice.
Sure, doctor. I think we have been getting more and more questions. I think we have almost 20 more questions. I'll try and keep this as short as possible. We already are over time, but we will take up some of those questions. Yes. So Mr. Rohit asks, can uterine cyst cause cancer?
Uterine cysts have no relation to cancer.
Okay, thank you, doctor. We'll move on to the next question from Mr. Farhat. Does nicotine patch or gum also cause cancer?
Nicotine patches per se are given as a treatment options for de-addiction for this smoking. Per se, they don't have carcinogenic risk, but even nicotine patches, when taken over a prolonged period of time, that itself can have an addictive agent. I would say it's an addictive agent more than a carcinogenic in this situation, where the patches are used for quitting for smoking because the dose is very, very low.
Sure. And then there's one question from Mr. Ved. Can diesel generator smoke cause cancer?
Potentially any harmful smoke contains petrochemical products, contains a lot of harmful products. We are all exposed to it in the industrial world. Live in a traffic prone near the city. Yes, we are all exposed. But if you're going to be in a closed environment, working in a garage where you're continuously exposed, it is definitely not healthy. And it can, over a period of long term, can develop cancer.
Okay. And we've got one from Mr. Muniraja. My brother has HbA1c positive. Any treatment is available for this? You want to take that up, doctor?
HbA1c positive is hepatitis B virus positivity. It has got a lot of treatment options. You please consult your gastroenterologist or a general physician. They will be able to guide you. Long-term treatment options from preventing them to developing a cancer is definitely there. So please consult your physician.
Sure. And there's one question from Mr. Namdev. How does bone marrow cancer occur?
It is multifactorial. It's sometimes genetic, but that is one of the common. There are common bone marrow cancers in both children and adults. In children, the commonest is leukemia. In adults, it's called a myeloma. So it is all multifactorial. We really don't know a particular common factor that causes the cancer. So that's a very complex genetic.
Sure. And there's one question from Mrs. Meera. After radical hysterectomy for stage 1 uterine cancer with brachytherapy for 70-year-old lady, what are chances of recurrence?
Stage 1 uterine cancer, the fact that brachytherapy has been given, it's probably 1B. The chance of recurrence we are talking about is 10% over a period of 5 years. 90% she's already had a good chance of cure.
Okay, so there's another question by Mrs. Bhuvana. How does Ewing sarcoma form, and is it genetic, and can the life of a child be prolonged?
It depends upon the stage and the risk of Ewing sarcoma. So I think I would recommend you see your pediatric oncologist for the treatment options.
Okay. Okay, there's one from Mr. Natarayan. My mother is diagnosed with uterus cancer at the age of 55, brother with prostate at 55. I'm 48 years old. Did PSA, endoscopy, chest x-ray, ultrasound scan, and gene testing. BRCA is positive. Just received the result. Kindly advise.
See, this is a very specific situation where you need to map out the family tree, the genetic analysis, his risk, his investigations. These all require specialist consultations in an oncology clinic.
Sure. And then Mr. Manoj says, can you arrange for recording of this webinar? It is very helpful. Yes, Mr. Manoj, we will reach out to you after this webinar. And then we've got one from Mr. Raj Gopal. PSA is 10. No other symptoms. Should I go for a biopsy?
You need to have an evaluation with your urologist or your clinician. Have an ultrasound done. What is your risk? What is your family risk? What does the ultrasound say? Based on that, a biopsy may be required. So it cannot be generalized with just a PSA value.
Okay. And then we've got one from Mrs. Meera. Do antiperspirants cause breast cancer?
I think these are not actually proven by various studies. So it is very difficult to say at one single point of time whether they cause cancer. It also depends upon how long they've been using and what kind of product they've been using. So presently we don't have it in the risk factor list, but it is better to avoid such additive things over a long period of time.
Sure. And I think there are a lot of other people requesting for the recorded webinar because it was very useful. Thank you, all of you. We will reach out to you and try and get the recorded webinar to you. It will also be available in YouTube and other social media platforms. And before I wrap up, I will just check if there's any other question we can answer. Kindly give me a second. Okay, there are some medical questions. I would redirect you to the oncologist. Okay, so I think that's it, doctors. I think we can wrap this up. Most of the other questions have already been answered, so I'm skipping most of it. I'm sorry if we've missed any other important question. We've had a lot of questions this webinar, and we have tried to answer as much as we can. Thank you, all of you. Moving on, we will just wrap up. We have now come to the end of our webinar today. I would like to extend my heartfelt appreciation for both our panelists for taking the time out of your busy schedules to be here and answering all our questions and clearing all our doubts. I also thank the amazing audience for being here and participating so actively in our webinar. I think this is the highest number of questions we have had. And for those who are fighting cancer or know a loved one who's fighting it, remember that even the darkest night will end and the sun will rise. For the others, remember that true prevention is not waiting for something to happen. It is taking all the right measures to avoid it happening. So we hope this webinar was useful for you and helped you learn a thing or two. Watch out for the next webinar. Until then, have a good weekend and thank you.